Cloud. Okay, so today we're going to focus on some meridians and acupressure points on kidney and urinary bladder, which are especially good for anything to do with the back, neck, shoulders, including low back and sacrum, anything all the way down the legs, knees, and down into the feet, and then in the front, the chest. So because urinary bladder goes all the way down the back and back of legs, and in myofascial release, it's related to the superficial posterior line. The kidney meridian, it's a yin-yang pair, and remember, you often want to treat yin-yang pairs together. The kidney meridian is on the front. It's the yin of the two pairs. And a big part of it goes through the chest. So it's especially good for any issues related to the chest, like asthma, bronchitis, pneumonia. Also, if there's any problems with the kidney deficiencies or meridian issues, could also relate to low back pain or menopause. So what we're going to do today to open up and treat these channels is to work with some key points, which is an acupressure strategy, and we're going to work with bigger lines of the meridians, which is a shiatsu strategy. What we're not going to do is touch every single point. We don't need to touch every single point. We can focus on some powerful points and the pathways. You're going to recognize with this urinary bladder meridian that we're going to be going right through the erector spinae and our multifidi and rotatories and so forth. So, and our trapezius. So the urinary bladder starts way up at the inside corners of the eyes and goes all the way up and over the head. But we don't need to touch people on the eyes or near the eyes. Again, you can treat all the points for different things, but it's a little overwhelming to learn them all. So instead, we're going to focus on some key points. So this is a really powerful strategy I'm about to teach you of key points to open up and treat urinary bladder. So up in the hairline, right, the suboccipital area, bilaterally, just lateral to trapezius, and you'll see this on the client we're going to work with too. But here is urinary bladder 10. And then urinary bladder in the back splits into 2 on the right and 2 on the left pathways. And you can treat them kind of with broader pressure, or you can get specific with both lines. So where are the 2 lines? The outer line is just on the inside of the medial border of the scapula, sort of at the level of where the spine of the scapula comes in. And the reason I call that marcation out is because, of course, people can have their scapula rotated or farther forward or so forth. But going from there in a straight line down all the way to the sacrum, that's the outer line. Now, I said a straight line, but I should call out that these meridians do shift with body changes. So if somebody had moderate or severe scoliosis and they had a big curvature of the spine, the meridians are going to follow that. So if the spine was traveling around like so, the meridian is going to travel around like so. But if the spine is relatively straight, we're talking about a straight line. The inner shoe, these are called shoe points in this area. The inner shoe line is between the midline, mid-sagittal or spinous processes, and that medial border of the scapula. So halfway between the two, all the way down. So you can see that relationship with the erector spinae group. I'll show you in the treatment how we're going to work with those. Then there are points all down the sacrum. You don't have to memorize the name of all of these. You don't have to memorize the names of all of these, but you can just treat all the way down. We'll even just do some pressure on the sacrum. Now, some people want to get more specific with this. So I'll tell you exactly where the points are, and you can either be specific or more general. Between each spinous process is a divot. And it's at that horizontal level that you'll find this inner and outer line. So between the spinous processes, you'll find that inner and outer line. So you've got 2 and 2 on each side at the level between each spinous process. You can be, actually feeling for every divot, or you can estimate your way down. Now, these points are all good for the general, right? Anything in the neck, shoulders, back, mid-back, low back, sacrum, lower, the thighs, the knees, etc. Anything on the meridian. But these points are also very good for tonifying and balancing the whole point, the whole body. So at each level, there's points that have a specific relationship to an organ. So for example, at the level of T3, we've got a relationship of points that tonify the lungs, T4, pericardium, T5, heart, and so on. You don't have to memorize all of them though. It is very acceptable to just treat all the way. And it's also very acceptable to just look up, if there's one that you think someone might need more tonification of or balancing of. For example, if they had a lung problem like asthma or a chronic lung problem, you could treat those points. The other thing is you can just treat where it's either overly tender or overly tight, and that's a good way to treat. Now I'm going to teach you a bonus line too while we're here. This is not on the urinary bladder, but it's a very effective line, and that is right in the lamina groove. It's like 1/2 inch to the side of the spinous processes. And again, it's at the level of those indentations. These are called Huato Jiaji points, and it's named after a doctor, Huojiaji, Huato Jiaji. And these are very powerful points, as you can imagine, for the rotatories of multifidi, which are those muscles that if somebody has a subluxation and those vertebrae are rotated a little bit, those points are very powerful. A good way to treat those is if there is a little bit of rotation or soreness, or that they're out a little bit, is, let's say it's at this level, is to treat a couple of them above, the one at it, and a couple below. So rather than just at the level of it, you go all the way from a couple segments above, through it, and below it. And so again, they're right at each of those spots, right there in the lamina groove. So we're opening up the urinary bladder meridian. Again, we're going to start with urinary bladder 10, side of the traps right in the hairline, and then we're going to work our way down these UB shoe points all the way through the sacrum. The next power point we're going to do is just below the ischial tuberosity where the hamstrings attach, which is also a trigger point location for the hamstring. So there's a lot of overlap between trigger points and acupressure points. In acupressure, this is urinary bladder 36. And as you know from massage, it's a great place to release the hamstrings as well. Then we're going to go down. There's points in between here, but we're not doing all of them. We're going to hit some power points right in the middle of the popliteal fossa, where of course you want to be gentle, is urinary bladder 40. Then we're going to go down to where the gastrocnemius heads come together, is urinary bladder 36. And then we're going to go to the lateral side, right behind the lateral malleolus is UB 60. Now this meridian travels all the way out the 5th metatarsal, so we can just do some massage out there. I'll show this on our model too, and then how we're actually going to massage it. But for the kidney meridian, it's yin pair. We're going to start at the base of the foot where the thick skin and the thin skin meet in the middle at kidney 1. And then the kidney meridian comes along the inside of the foot. We're not going to do all the points, but if you want to go under the navicular bone is kidney 2. And then all around the inside of the ankle, with a primary one being right posterior to medial malleolus is kidney 3. And you can just do this whole area, and right in this divot, inferior and anterior to the medial malleolus is kidney 6. So those are our power points there. Right on the inside of the ankle, you can go up the medial tibia, up to the medial knee. And this is going to go, we're not going to do the whole area, but if we were, it goes up the abdomen. Where we're going to pick up with it again is these power points just lateral to the sternum. And between the rib spaces, you can treat any of the points where breast tissue is not in the way. Now, again, kidney and urinary bladder are powerful pairs. So any issues on either meridian, you can open up any of these points. So rather than just treating locally, we want to open up some distally, proximally, and then it's matching pair. So let's see this on our client. And do you have any questions? Thank you very much. Following along. I'm going to use some hand sanitizer after touching that. All right. So we're going to combine, is that a comfortable face cradle and support under your ankles, or do you want to change anything? Good. And the table temperature? Good. Yeah. Okay, good, good, good. So in a lot of regards, you can do everything you already know about compression along this line. So any of your techniques that are kind of warming, including compression, including using the hot stones, the Himalayan salt stones, a hot pack. And I'm going to try to keep the demo as short as possible. You already have a lot of compression skills. So I'd like to show you kind of integrate this and approach it with these points, but give you as much time to really practice it. So just like with your massage and all the palpation skills you already have, right from your beginning, you're assessing. You're assessing where is the client more mobile, where are they more stiff, where is their resistance, where can you feel their breath, where do you see and feel the movement. And I feel there's more stiffness here, and you can see that makes sense with the posture too, right? So, and again, this urinary bladder goes all the way into the sacrum, so we want to take this into the sacrum as well. I can feel that there's a kind of a big curvature here and some more stiffness here in the sacrum. So I'm trying to use a lot of pressure there in the sacrum to warm things up. Yep.
What is the significance of the urinary bladder versus the kidneys versus, does that make sense?
Can you elaborate a little more, please?
I'm trying to think of how to say it. How do we know to use the urinary bladder because we were talking about some of those things like menopause or lower back and things like that.
Yeah.
If you did say like the kidneys, meridian, would they be treating completely different things, or is there overlap?
Yeah, so we started talking about some of the strategies last week. Each of the meridians has very complex relationships about what it relates to as far as chi and organs and imbalances. And to study those in great detail can take a while. So what I've been trying to do is call out some primary patterns that you're going to see, and also the musculoskeletal pattern that you can follow for all meridians, which is wherever the meridian travels through, if there's an issue in that area, those are the meridians that you can focus on. So if we know that she's got a little bit of tightness here, if the client has tension and or pain here, you can treat all of the meridians that traverse that area locally, as well as superior, inferior, proximal, distal. And then you also treat the yin-yang organ pair. So if there's an issue here and urinary bladder travels through there, its pair is kidney. So we're going to treat kidney and urinary bladder for this. But if we're treating like the shoulder, in addition to this meridian travel through there, there's other meridians that travel through there too. But today, we're just focusing on 2 meridians. Does that answer your question, and are there follow-up questions?
So we were going to treat urinary bladder today, just as an example anyway. But then were you saying that the thoracic region happens to line up with that as well?
Well, as I'm palpating, I could see and feel that this area is tight. We will go progressively through meridians to learn them and how to treat them, where they travel and what they're good for. So we're starting with the urinary bladder and kidney because this urinary bladder, the way that it travels, it is effective for people with neck problems, back problems, upper, middle, lower, sacral, thighs, knees, calves, ankles, feet. So you can see this is a tremendous number of our patients, right?
Mhm.
So this is something that you can integrate this opening with a huge number of your patients, right? And you can use all your other massage techniques too. As you can see, this is a lot like compression, but the difference between what you knew in compression so far and this is that, instead of just like, compressing in general the ESGs, you're going to now add some powerful acupressure points and follow the meridians specifically and follow them to where you're opening the whole pattern. And you'll see very shortly that there's this overlap between some of these meridians and some of the anatomy trains for myofascial release. So in the same way that you would treat a whole fascial line for certain issues, you could treat those same meridians. Is that helpful? Follow-up questions? So use all your massage skills that you've already acquired. These are not like abstract mystery energy lines. While they are also energy lines, they also relate exactly to our physical being. So I'm warming up here. We've got a curvature here and a tightness here, so that when I use my pressure in those UB points, I'm also stretching it inferiorly. And I can use both hands, So you notice I don't have to travel just down or just up the meridian. I'm working the meridian just like I would with massage. And I'm warming things up and I'm assessing. I got a really tight spot right here, but I've been it's opened up a lot since we started. When we started, it was overall general tightness and stiffness. And now that it's warmed up enough, I can feel this very specific muscle right there. And it's on our inner shoe line. So here's the medial border of the scapula. Here's the spine of the scapula. So here's our outer shoe line and our inner shoe line. So she's got a tightness there on the inner shoe line. Now, since we got a general warm up, one strategy would be to work our way down those UV shoe points medially and or laterally, and we could treat them in a very acupressure kind of a way where we're specifically on each point bilaterally or one side at a time, and or you can use bigger, broader tools and kind of treat the bigger meridian pattern. And you can go back and forth between the two strategies. Just like with your massage strategies, it often works to kind of work general to specific to general. So Again, if you want to be really precise in measuring these points, you find spinous process, and it's at the level of the divot between them. There's a spinous process divot. And some are going to be easier to feel than others. So some, you know how the thoracic vertebrae shingle over each other and they face downward. So sometimes you're going to feel bigger or smaller gaps. If you want to be precise, you go at the level of the divot and the inner line and the outer line. So again, the outer line is to the medial border of the scapula, and the inner line is halfway between the spinous process and there. So here's our two lines on one side, and here's our two lines on the other side. Now, it's okay to go slower at first and really measure those points. It is also okay to estimate them. We're definitely dealing with the myofascia here as well. So we don't have to slow down and measure every point, right? We can go down, and you're going to use whatever tools work for you. I don't know if you can see this visually, but there's a big difference in the side we warmed up and the side we did not. So, I mean, you can even see that visually here. So I would, in a real treatment, I would warm this side up more. In fact, I'm going to do that just a little bit. I want to keep the demo as short as possible, but in order to show you some nice bilateral work, I want to warm up this side enough that you can really work with that. Now with that meridian going down through the sacrum, you know, you can do that lateral of the sacrum, lateral border of the sacrum work as well as right on top of it. Your elbows, your fists, you know, whatever tools work well for you. And take your time warming up where it's tight. You can really use that rocking motion with the compression that I showed you, like the second week of school. I find that you can get a lot of work done with this technique. Okay, so big PowerPoint. We want to open up UB10 and then open up downstream. So just to the lateral sides of trapezius, right in the hairline. And whatever hand position works well, you can use both hands. You know, if that's better for you to squeeze in and angle up, or if it works for you to use your hands together. You know, obviously we don't want to push down on the client in this position. So we're going to squeeze in and up, or even angle into that fascia. So
Are you,
I'm going to
how much pressure are
use
you
my hands
using?
together.
I think Chris had a question.
How much pressure are you using? Are you still waiting for the muscle to kind of push back into your hand, or are you thinking about something else?
Yeah, I'm using as much pressure as I would with compression or massage. So we're going to start off lighter while we warm up the tissue, but then use quite a bit of pressure. So I've got some good muscular areas here. So I'm using as much pressure as I would to release like trapezius or erector spinae in this area. Now, that's because I'm in a nice muscular area on a yang meridian. There's going to be some points that are in soft, squishy areas or bony areas and yin meridians that we're going to go a lot more gently. But this is as much pressure as you would for, you know, a nice, you know, as deep as the person enjoys it massage. And this meridian comes up over the shoulders like so. And so, you know, again, open up this meridian with all your yummy and effective massage techniques. I feel some tightness here. Okay, so let's get on to that treatment of inner and outer shoe lines. We've already gone over the measurements. You can treat on the inner shoe line both sides at a time. The exact hand position is just sort of one of many. This is really just like massage. You want to use tools that work for the size of the client and the size of your hands. So you could even use knuckles. You could even use fists. You can even use forearms or elbows in here. So like if I'm on a tight spot, I need more pressure, you can use an elbow even. And notice I'm using my other hand to protect her spine. And on that pressure scale, 1 to 10, if 7 is perfect, 10 is too deep, 1 is too light. Yeah. Good, excellent. So notice that when I use this kind of tool, I'm only treating one side at a time, and that's okay. Like we can take our time with one side at a time, and then we can work the other side. How long do you hold each point? It can vary. Like if you've got a tight spot or an area that you know needs more treatment, you could stay with a point as long as a few minutes. But you could also treat in a more general way where you kind of just go down like compression at a faster pace. Obviously adjust your pressure when you get to the low back, especially if you're using an elbow. You don't want it to be too pointy in the kidney area. So that's kind of how you can go all the way down, and you can do the same thing on the outer line, and you could even address both at the same time with a broader tool. Now the inner and outer shoe lines, I mentioned that at each level, they actually tonify and balance a specific organ. Like T3 is lung, T4 pericardium, T5 is heart, and I just estimated rather than measured. People may sometimes wonder, when do you treat outer, when do you treat inner, do you treat both, does it matter? The outer line is more to do with emotional and spiritual issues or manifestations, and the inner is more physical. But as you know, there's often both, right? So like even if something started as a physical issue, right, there might be like emotions coming up because of it. And so basically you can always treat inner and outer lines. And she's kind of really opened up a lot already in here. And we could take our time all the way down. I want to go faster so that you can take your time all the way down. So then we've already, you notice I treated the sacrum already. You could come back and do that slower, right on the sacrum, as well as the lateral border of the sacrum. So feel free to take your time there. Then we're going to go to UB36. Yes, as in urinary bladder. So you can abbreviate these urinary bladder points as UB for urinary bladder, or you'll see them in books sometimes as BL for bladder, and you'll sometimes even see them as B. So those are the abbreviations you'll see. So our next major power point is UB36, which is right at the ischial tuberosity. We discussed this in kinesiology yesterday, that great approach for this is, you know, all the hamstrings attach here, right? A great approach is to come up under the gluteal fold, pressing at an angle like so. So you want to get into that ischial tuberosity. We don't want to angle in towards the gluteal cleft. And we don't want to work bilaterally and really, you know, make it feel like we're moving their glutes. So we want to go just straight into that gluteal fold, right onto the gluteal tuberosity. Now I'm using, see, a straight line strength without hurting my joints. You need a lot of pressure on this point. So this, a lot of people, you can also use your elbow. Notice when I use my elbow, how easy it is to have my hand on the rest on her UB40 and my arm on the rest of her UB in her gastrocnemius area. So I'm treating the whole lower line at the same time in this position. How's the pressure? Okay, good. Again, you can hang out here a while. Now remember, if they got any issues upstream or downstream, like let's say low back pain, mid back pain, neck tension, urinary bladder travels all the way through this. So this is all good for opening that. So don't think like neck, you're just going to stick with the neck. You're going to open up this whole line. And like I said, you'll see in MFR that the superficial back line of anatomy trains follows the same pathway. But this system came thousands of years prior. Now, obviously, right in the middle of the popliteal is an endangerment zone. We're careful about the nerves and arteries, but you already know that hamstring tendons are strong around it. Hamstrings. We can apply pressure here, and people actually often feel supported in the knees. In addition to these meridians, there's sort of these resonances between different areas of the body, and there's something resonant about the knees and the low back and the sacrum. So, you know, with so many clients having sacrum and low back issues, not always an emotional component, but if there is, a lot of times people kind of who are processing like fear, or any kind of grounded issues, like issues with money, home, finances, whether that's like an old childhood thing they're dealing with or a current thing, a displacement thing, right? Again, not all low back issues have to do with that, but when there's an emotional component to, there's often, you offer them support at their knees as grounding as well. Yep.
With the knees, when we do massage, a lot of times we gently go over the popliteal.
Yep.
Do you ever do that?
Yep. Yep. You can do that too. There's two UB points in there, and it's okay to touch them directly. Yep. Now, again, there's other points, and we can, a shiatsu method is to treat them along the way. We have learned in compression and kinesiology that the hamstrings can be a little jumpy. So we're a little slower and wider pressure and heavier with them. And now as we get into the gastrocnemius, a power point is UB57. So where the heads of the gastrocnemiae come together, which is very palpable, and you can also often see, and you can also follow your way up the Achilles tendon, and where that meets muscle tissue is UB57. So again, these are not all the points, but these are super power points. So UB57, UB40, UB36, and your shoe points are going to really help you open things up. You can make connections too. So like I can talk to UB36 while I talk to UB57. I can use whatever tool I need. So all your tools, you know, whether it's a knuckle, a fist, a hand, or supported hands. And again, you can do all your massage warm-up strategies, get that tissue warmed up, and then get in there. This is also a trigger point spot. So again, there's a lot of overlap between acupressure points and trigger points. The acupressure point system came first, and not all acupressure points are trigger points. We come down. The last points we're going to do here, right behind the medial malleolus, between the medial and lateral malleoli and the Achilles tendon, are kidney and UB points. So on the UB side, which is the lateral side, is UB60, and on the kidney side, it's kidney 3. And so you can treat both at the same time. And even you can see I'm adding some traction there. Kidney 1, again, where the thick skin meets the thin skin. In reflexology, that's the solar plexus point. So you can make connections between those points as well, whether it's a broad hand or deeper pressure. And to keep making these meridian connections, feel free to do things like I'm in a traction here. I'm going to talk to UB57. I'm going to talk to UB40. I'm going to talk to UB36. I'm going to talk to all the sacrum points. So I'm still pressing this way as I talk to sacrum points, etc.
So you go down, but then you also kind of backtrack. And
You can go back and forth. Yep. Help make connections. And you can feel like when it feels like there's kind of a stop up between places, like when you do your rocking and you see where it's moving and where it's not.
Mhm.
So sometimes you'll open things up going distally, and sometimes you'll open things up going back up.
Mhm.
Yeah.
Zefire, are you feeling energy when you do that?
You can feel energy. Yep. Yep, for sure. So you want to, stay nice and grounded.
Mm-hmm. Actually, I'm working on the feet.
Yep. And these are winter or water meridians. All right. And if you're tall enough, whatever your reach is, that UB10 up here at the traps, we could make connections. If you're tall enough, you can make a connection all the way down there. I'm not really tall enough with that client, so. All right, so we're gonna have you roll over and scoot down so your head's on the table.
Can I ask you, when you're doing the treatment, you're not giving a demonstration, you're just working on somebody.
Yep.
Are you internally in a space where you're just kind of in the flow, or are you having any intention inside
Yeah.
when you're working on someone?
Yeah. So my most common intentions are holding a space of unconditional love. And what is for the client's highest good.
Mm-hmm.
My other intentions are, these meridians and points can work a lot with balancing the body. Of like, if you think about an analogy of like beaver dams, like these are like rivers of energy, but sometimes beaver dams get in the way. And so you're also like unblocking the beaver dams, so the body's own energy can flow and strengthen. So you're opening up blockages and you're building energy where there's low energy. So some of your intention too is like inviting the energy flow into areas, or to facilitate opening in areas. And sometimes that intention, if you feel like there's vapid energy or missing energy, vacuous or black hole kind of energy, or a blockage of energy, your intention can also be to help bring the client's attention to that area. So they're balancing their systems, but you're paying attention. And so you're also, just like your other massage, like I kind of mentioned, is that you're still very much paying attention to the cues of like, if you rock them, where are they moving and where does that movement stop? When they're breathing, where do you see it and where do you feel it and where does it stop? And that's all giving you cues about where the blockages are. And you're working to help unblock those blockages. Yeah. My 12-year-old watches a lot of interesting YouTube videos. And one of them is this guy who goes and he clears out the stuff that gets stuck in culverts. So like the tubes that let the water flow under roads and stuff. Mm-hmm. So it's a lot like beaver dams too, where, removing the stuff that's blocking what flow should be there. So notice again that a lot of this looks like massage. You use all the massage techniques at your fingertips, but you are using the knowledge of where the meridians and acupressure points are and helping open them up. So our kidney one again starts where the hard and smooth skin meets at the bottom of the feet. I can treat both at the same time, or I can treat one at a time. So if I want to, I could really support the leg, the foot, like we do in reflexology or foot massage, and really get in there. I can get in there with a bigger tool too. And this is a great grounding point, and it's kidney 1, and it helps open up the base energy for the whole body and the energy that comes in through the earth. So if people are blocked here, they're blocking off a lot, and this is good to help open it up. In martial arts, it's sometimes called like the bubbling well, and you really want to open this up. If you see people that the whole bottom of their foot is like curled in or like recoiled back, this could really use help softening and opening. People might do that in response to trauma, or it could be in response to other things. But, while people understandably create all kind of blocks and barriers, it's maybe not the best strategy to block your feet energy with earth. Cleaning equipment, maybe. Is this pressure okay? Okay. So notice I'm really opening up with stretching and compression. All right, and I'm going to switch to this side because you can probably see it better. But again, we go under the navicular bone is kidney 2. Kidney 3 is behind the medial malleolus and the Achilles tendon. Kidney 6 is right in front of and distal to the malleolus. And again, you've got notes with pictures, and I showed you on the skeleton. I don't expect you to be super precise with all these. When you use finger pressure, you can use your intuition and what you feel and what's going on with the fascia and the muscles. I'm very precise as an acupuncturist. When we use needles, we have to be very precise. But it's okay for you to feel your way into this and not like, you're not spending your time measuring these points, right? Like you're massaging this whole inner ankle area and you're really working it out. If you want to take your time to measure each point, not in a real massage session, you can do that to get quicker at finding them. But during a massage, you always want it to feel like a massage and not like you're measuring points. But I'm working all the kidney points in the ankle. They come all the way down here. And you can slow down, right? Change your speed. If you find something tight, go ahead and slow down. Respond to their breathing. Now, all the yin meridians on the lower leg kind of crisscross in this area. So when we study kidney and liver, you'll see we work the same area. There are some points where all 3 meridians cross, and we can just kind of work our way up this medial border for now. We don't have to be precise whether we're liver, kidney, or spleen. I'm squeezing both sides, so I'm getting the yang side as well. So I'm getting the tibialis anterior and the peroneals as well. They're on the yang side. We're always sensitive to and careful with people's medial thighs. The meridian goes up there through the adductors, but I'm never going to go up too high or be ticklish for modesty reasons. But I can open up meridians from working above it and below it. Kidney does travel through the abdomen, and it can be powerful to work the abdomen. It can also be vulnerable. So we're just going to skip it. People find it less vulnerable with tuning forks. So if you want to put some tuning forks there, go for it. And we're going to end up with some kidney points on the chest. And again, this is the yin-yang organ pair with urinary bladder. So you can use this for any of those things that are in the back. Again, the shoulders, upper back, mid back, low back, knees, etc. But the kidneys in this lung and chest area are also great for lung issues. So just lateral to the sternum, in between each rib space. And I'm going to use like a flatter finger pad. I'm going to use several fingers supported together just so it feels more supportive and less pokey. But an individual pad is focusing on the point while the others are supportively in the area. So all of my fingers are traveling together in a rib space. The rib spaces are obvious because the ribs are very smooth and slippery above and below where you want to be. And these points may feel tight. And if someone has asthma, tight lungs from anxiety, or tight chest, cold, like they were recovering from a cold or anything where they were coughing a lot, or your loved ones, you could treat them when they are sick. So if they had a bronchitis or anything. Again, you're bringing your massage skills to the table. So notice I'm rolling her shoulders out while I do this work. This area also corresponds to anatomy trains that we'll be studying soon. Again, keeping in mind that this system came thousands of years before, but just you'll notice that there is some overlap, significant overlap between many of the anatomy trains. So again, we're thinking fascial line opening as well. Yep.
So I'm really familiar with feeling a lot of energy or energy movement in inside areas, feeling warmth and a fullness.
Yep.
But a vacuous feeling, I'm not as familiar with. Would it be more of like the opposite of that? Could it feel cool?
It could feel cool. Could feel numb. It could feel rubbery.
Mhm.
Another way to kind of think about it, I know you have kids, and so I'm sure you held them ever since they were babies and touched them at different ages. It's like that feeling of a baby or a young child where there's just so much vitality in their tissue that it's like springy and soft and full of life.
Mhm.
Vacuous is like the opposite of that. Yeah. So now, depending on how much breast tissue there is, right, you can go between all the rib spaces as far down as you can get without getting in breast tissue. Or, like if it's your partner or yourself, you can treat the rib spaces even in breast tissue. But I'm only going to reach these two, and they feel tight, possibly tender. You can circle. You can hold steady, like prolonged ischemic compression. You could do that at a massage depth that is like a client's pleasurable depth. Or you could do it at just enough pressure that you can feel the flow of energy, which is like a Jin Shin Do strategy. And we'll study some Jin Shin Do, which I think the way you work with energy, you might feel akin to sort of just get right in there and just be still and present with it.
I have another question, actually.
I got one more before you go.
Okay.
You can also do it with an MFR strategy. So we can get into the point and stretch. Add a little twist and keep stretching. You can even do it with a pin and stretch strategy. So in this case, we've pinned and stretched the pecs before. So I'm going to show you that one as well. We can get into the point and pin and stretch. So I hope what you're noticing is that all your massage skills can be brought to bear when you're treating acupressure points and meridians. The primary difference is that you're aware of relationships and whole pathways of these points, so that you're not just treating things locally as you find them, but you're strategizing, oh, okay, this is the problem. These are the meridians and points that I could treat and treat them upstream and downstream. And another advantage, right, is if we had a local contraindication, but an issue here, we could treat distally, proximally, and also opposite side. So I'm going to end up with the urinary bladder again, and we're going to wrap up there. As soon as I get in this hold, you can do your question. So we're going to go back to urinary bladder 10, which is that point just on the side of the traps, trapezius, just in the hairline. There's yummy tight fascia in this area. I can go up towards her eyes or her eyebrows, or I can circle in and out. I can again hold prolonged ischemic compression steady. I can do MFR. I can do pin and stretch. I can do circular friction. I can do linear friction. I can do a gentle static hold. This is even a point where we would hold a craniosacral move. So, I mean, I could really even just support her head and hold her like that. And the meridian comes up here. So I could bring that like this and be really still. I'm going to lift up here at the eyebrows. I'm lifting up gently. I'm squeezing supportively at her neck. And we're just going to hang out a little bit. So while we do that, what's your question?
Yes. So when we started, it was either on the cervical or kind of the junction of the cervical and the thoracic.
Yep.
You were saying if there was something that felt out of alignment.
Yep.
So I was wondering when you were on the ribs,
Yep.
on the pec area,
Yep.
would you just kind of give that some movement if you felt it? Because I'm familiar with having ribs out of place.
Yeah.
Would you do some type of jostling, or what would you do in that area?
I would recommend, I mean, you could do some jostling. I would recommend like some MFR and some static holds. I can teach you rib releases that are in our scope of practice. And that is actually more where the ribs attach, but you could definitely MFR the fascia where it's tight.
Like on that.
Cool. So I'm kind of pulling her fascia up and over her head in a supportive way. You can use more pressure on the head than you would think. It could be very comforting. I'm trying to be comforting to her head. So I've got her in like a comfortable head support and MFR stretch, keeping in mind that that urinary bladder fascia comes up all the way up and over the head. All right, go and wrap. Thank you so much for being our demo. Thank you so